In the 15 years since it was founded, athenahealth has come to be recognized as really the very definition of the disruptive technology company in healthcare. No other revenue cycle related company has ever achieved their scale with purely organic growth. I would argue that no EMR company has achieved their level of engagement. Their meaningful use certifications are many multiples those of their competitors. The market agrees with this success and has rewarded the company with sort of eye-popping PE and revenue multiples. For all this success, Jonathan Bush wants more. Global domination. So to articulate that vision, where we are today and going forward, and I think also tying together many of today's themes, I give you Jonathan.
Thanks, guys.
Clicker is right there.
Clicker. I'll just stay right here. Okay, I'll be brief. We think that one of the, like Verizon maybe, one of the missing kind of meta layers, one of the missing fundamental ingredients to entrepreneurship is a cleaner, easier, is the existence of any information backbone at all that we can have in common with each other as entrepreneurs and that we can in turn make providers have in common with one another, and ultimately patients have themselves in common with other providers, among providers. Most efforts to make a backbone have been very top-down and very dumb and very unsuccessful. And so what we've engaged upon is a mission of getting the issuer of orders, the creators of information, to use our backbone in exchange for a basic trade. We will take shit work that you hate and suck at, and we will do it for you if you give us a little percentage of whatever improvement we make, and if you agree to use our backbone in the meantime. And that's now up to 5 services. We do your claims scut work, your medical records scut work, your patient communications, we do your hospital admissions and referrals. And each one is kind of loaded with all kinds of crap about deduping and checking with the insurance company and taking the information that isn't online and bringing it online in order to analyze it. They also are supposed to all have in common the idea that they get the doctor paid a little more for doing the right thing than they were doing before. And obviously we operate within a code. So that's kind of the company that we've ended up becoming, and it's working. You know, it's happening. We every year find new scut work to do that doctors hate and stink at, and every year we get more doctors to jump onto the network for one of the now 5 services that we offer. We started as a failed clinic. We had this idea of women's health clinics that used better care pathways than the ones that are currently used today. In fact, this remains a really great opportunity for those of you who want to raise money and do something directly in healthcare. I don't think there's ever been a better time to get directly into the provisioning of health services than today. But anyway, we couldn't get our claims paid, we couldn't keep the information current, and we couldn't get agreement from those who paid us on the improvements that we were making such that they would be willing to cut us a check for a piece of the improvement, and our whole business model hung on that. So in order to keep from drowning as the waters sort of swirled around our nostrils, we built a little website called athenahealth in order to keep track of our 13 little offices and our wonderful hourly workers that sat behind the sliding glass windows of the front reception areas. They called themselves Athenistas, largely Latin folks where English was the second language. Right on the border, our first clinics were on the border in San Diego County. And so, we had to make this stuff really, really straightforward. These are people that had to leave right at 5 for child care considerations. And they had to work their way through unbelievably complicated rules about different IPAs and the state Medi-Cal program and self-pay. If they couldn't get it, they get kicked out of one of those programs. How could they bridge it financially themselves? And that knowledge proved to be knowledge that everybody dealt with at every sort of strata of the healthcare system. And the network, the little website, which was called athenahealth today, has got 33,000 doctors, growing over 30% a year, providing lots and lots of stuff like that to Athenistas everywhere. There are the services, the 4 core services, also one called Anodyne. The small print are what we call the hedgehog test. So they actually have to, in order to use something systematically, you need a delicate balance of id and superego. I think this is true of any entrepreneurial venture in healthcare. You have to do good for the world. Your customer has to do good for the world by using you. And you have to make your customer more money by doing good for the world than they were making doing less good for the world. There's lots of ideas, including most EMR companies, that will do good for the world at the expense of the bottom line of the doctor. And those are going to be short-lived. First, whether it's the government temporarily pays and gets bored, or the hospital temporarily pays and gets bored, the basic idea of you go slower and make less money, and we in the abstract will have better data, is a totally bankrupt idea, literally as well as figuratively, in our opinion. And so each one of the services that we launch have to carefully pass the test every month that they are making the user more money as well as the society more benefit. And those are the, so you can imagine with clinicals, the average doctor, even after getting an EMR, is getting over 1,000 faxes a month. So, it's weird. But if we read the faxes, we can take a lot of cost out. So we have to then read them at a loss, figure out who sent the fax, and get them to connect to us electronically. And little by little, therefore, following our own economic incentive, build out a backbone. That's just one of the examples. So that's the kind of company. Click. Now we'll do I believe earlier there was some discussion about what is this cloud thing. Everybody uses it a different way. And, when someone asked the CIO or the CEO of Kaiser, what do you think of cloud computing? He goes, well, yeah, we have our own cloud. So we don't need, we just keep our own I could picture this Kaiser cloud over California that they controlled. So I'll give you my definition. And really there's 2 flavors of business model currently that take real advantage of the cloud, in my opinion. But first let's go way back pre-cloud. So you look at computing and technology, information management, entrepreneurship since sort of the course of our lives. The Paleolithic era was what it says here is Rebootus Maximus, was the software company, right? And what you do, the basic economic model is a bunch of instructions have been saved onto this disk, and they are related to questions to work that you do. And I will give you this disk, and then you will be able to trigger these instructions, right? If you type F, put female in the claim form or whatever it is, right? And millions of these accumulate, and the software gets more and more complex, can do more and more things. It becomes more and more functional, but harder and harder to use, and harder to afford. So it little by little obsoletes itself. And then maybe a new software company emerges. Also a new category of company emerges called the ASP, Reboot us less, pay us more. And this is the guy who will take that really complicated software product and run it for you. Figure out how to back it up and all the different features and menus and file routes and different table spaces that need to be maintained within a system. Many hospitals today have gone into business, are either clients of an ASP or themselves have said, wait, I'll be an ASP because the software, because there's still, healthcare is still primarily right in this space. But for the people in this room, it would be exclusively in this space. And so those companies, those ASPs will buy up this complicated software for you and then rent it back to you by the month, but it will be all backed up and there'll be someone who knows how to use it or load the next version of it when it comes out every 18 months. You've all heard of that, right? The ASP space. And, companies have done well. I mean, EDS and Perot Systems in the auto and then even in the healthcare space have made fortunes in the 70s and 80s with this business model. Then finally you get to the cloud, and my favorite cloud dweller is the great Mark Benioff. That's the first business model. That's the best cartoon I could find of Mark. So Salesforce.com is kind of the first generation of cloud-based computing business model that I know of, and that is, I've got one app. You don't have to pay for it up front. These early guys, by the way, you pay for it all up front, ASP a little bit less so, but there's no real connection between what you pay and the performance of the application. If it's hard to use, you don't like make less as the entrepreneur. Maybe you get less references or something. But SaaS is a little different. So the characteristics of a SaaS company that I think are interesting are, first of all the employees of the SaaS company go to work and log into the very same instance of the same application that all the customers log into. And so there's a transparency as to what works and what doesn't work. The other thing is, it's paid for monthly for as long as it's interesting to the customer, and then everybody's paid up and the customer walks away with no overhang. So most of what you hear about in healthcare as entrepreneurs in the information sector, what we hear is, gee, where were you 6 months ago? Or, I love what you're talking about, but we've got this huge investment in, Megatron, some system of, some investment they made of epic proportions that they can't get out of until it's fully amortized because they dare not go to their board of directors and declare that it's not working or that it's too painful, etc. Not true in the SaaS space. You pay more, and it's got to work. Everything's got to work. It's got to be fast. It's got to be convenient. You got to find the reports that you want. The data's got to be backed up. And if any part of it doesn't work, you just go somewhere else. That model changes the pace of the innovation curve dramatically because there's an incentive and there's the capability on the part of the entrepreneur to keep current with the evolving feature demand of the buyer. Does that make sense? Then lastly, you have good old Jeff Bezos at Amazon. Here, finally, the computing, the information management system isn't the product at all. It's just the store. It's the thing you go to get the product. Right? So nobody here paid for their license to Amazon. And they didn't pay up front for it and store it on their server. They didn't pay someone to store their copy of Amazon. They didn't pay by the month to use Amazon. They just use it. Right? They sign some permission slips, etc., click OK, and they've got the app. Right? Then Jeff Bezos goes around making that app smart enough to get you whatever you came to the app to get. Right? So if you came to get a book, he figures out how to ship you the book. And all of a sudden, this web company owns 35 million square feet of warehouses, and their most recent acquisition is a robot company. Right? Why? Because the goal of the app is to get you to buy the thing and then to get the thing into your hands. In fact, my favorite is the idea that, screw the warehouses, let's just let other people sell it, but we'll broker it. And then finally, the ultimate, right? Let's just squirt them the book, because they didn't really want the book at all. They just wanted the story inside the book, so we'll sell them a Kindle. So what you've done is you've gone from an alignment towards the utility of the app for revenue towards to an alignment of the utility app towards the outcome, towards the actual thing you wanted the app to do. If the thing doesn't happen, if Amazon works properly according to all QA and passes all federal testing guidelines for an appropriate e-shopping app, which in healthcare we have to do with C-CHIT, but no one buys anything on it, then it goes under, right? Whereas if they do buy, then it goes up. And the freedom to innovate that they have to deploy capital. By the way, we're dripping with capital and we got no good shit. So this is what excites me the most is this liberates folks like us to get in there and put more capital work, making bigger impact than the earlier business models ever allowed. So that's in Athena. We view ourselves as a cloud-based service. We get paid as a percentage of claims. Is this counting up, down, or not at all? I think not at all. Counting down from 28, but it's been at 28 for, anyway.
Oh, wow.
Well, it's counting now 5.
Disregard this.
From 28 to 6, 7, 8. 8 minutes left. All right. So I can't do this slide. I don't really understand it, but there's a lot of shit going on that doctors have to deal with. And the point is the warehouse, the robots, our warehouse and our robots is dealing with all this stuff. They get 30,000 pounds of paper every month. These doctors, actually, we get 30,000 pounds of paper. It would have been around 3.5 million pounds of paper if they hadn't gotten onto our network, because the average doctor getting onto our network is getting half of their information on paper, and the average doctor on our network is getting like 8% of their information on paper. So this is huge. But whether it's regulatory or just mechanical obstacles, that's the environment. I'm going to skip this. We know this is happening, and it's generally making it harder for cloud-based companies, I think, although things seem to be going okay for Athena. I want to give you 3 basic sort of points of view that we have on where the opportunity is for entrepreneurs in the realm of technology, information technology in particular. I don't think it's. I think that all of the existing opportunities are still there. EMRs really do suck. Ours sucks. They all suck. Ours sucks less every release, and we do 12 releases a year. So hopefully, soon I'll be able to say ours is okay. It's effective, but it's really not pretty. And in general, doctors are still feeling like, please bring me anything but the stuff I have today. And what they're really after is this. This is a painting by Luke Fields, and it's been cropped, but the parents are in the back corner, and they have really invested their faith in this guy. And if you look to the left, it's not there, but the doctor's instruments are behind his top hat. He's already tried all of the protocols. All of the clinical decision support has been deployed. And he is eye to eye with this little girl, and he is dying for inspiration. And by and large, what makes us so charged about healthcare, so unwilling to confront its escalation in cost, is the deep and important connection that we all have for this moment, both as providers and as patients and as caregivers of patients. And so the first thing you can do as an entrepreneur is find ways of bringing more of this to what exists. And I submit to you that if you check into, I spent last Wednesday in exam rooms all day long, the opportunities to enhance that moment abound. The next thing you could do, and this is mine, but the number of places where stuff gets done in the wrong place, the wrong way, by the wrong person in healthcare is overwhelming. The number of things that happen in a hospital that belong in a clinic, the number of things that belong in a clinic that belong at home, the number of things that are done by the doctor that belong at the mid-level, the number of things that are done by the mid-level that belong by the patient or by an app. It's just overwhelming, the number of opportunities in that arbitrage chain. This is the number of, you can imagine there's literally in America 200,000 people like this woman in the smock walking around. And by the way, when the hospital practice buys an EMR, the people in the smock don't leave. They sit in front of a fax server and type first name, last name into the fax server and then save the same documents to the charts, but now electronically. A thing called an EMR department has emerged, which I think is one of the most hilarious terms. So here they all are, very unhappy. This is new graphics from the Athena market. This is what happens when you go public. You get people who do that. See that? Now they're happy. So anyway, okay. Got that? I can redo a replay afterwards when I'm short on time. So that's thing one is that moment. Thing two is the moving the unhappy people to happy by moving the shit work they don't like off to the next person and the next and the next. There's so much opportunity for that. And thing three is a liquid market for health information exchange. So pretty much every effort at health information exchange has been using the noun form. It's sort of the missile headset where we're going to buy one. Lockheed Martin is going to provide an HIE, or Siemens is providing an HIE, and it sits in, Long Island, and everyone goes and looks at it. Or I don't know what they do. They certainly don't exchange. Verb exchange is really not happening. And one of the little known reasons why is that it's illegal. So if in every other industry in America, if the receiver of information wants the sender of information to send it a particular way, they'll pay. Say, look, I'll give you $5 if you give me this information. I'll settle your trade. Your interchange fee will be half price if you give it to me electronically. Your cash machine, the bank account, I'll let your banker use my bank machine, but I'm going to charge your bank $2 to do the exchange on the back end. Happens all the time. Illegal in healthcare, doesn't need to be, and I think there's room to move it that way. And even if it wasn't made, even within the existing regulatory environment, the ability to get into exchanges of information and lubricate it with interchange fees is vast. There's so many different kinds of exchanges that are just dying for somebody to come in and shepherd and curate. It's not like you build it and you leave it there and it works. It's a constant, iterative, exhaustive process. And so as you put it all together, the big three opportunities that I see, one, enable that energy, enable the moment that's in that painting by moving the work that doesn't need to be in that moment where it belongs. And then finally, enable the movement of work to where it belongs to not result in a lack of continuity by engaging in kind of open market exchange of information. It's not fully open, obviously, market because we have privacy considerations, but dramatically more open than it is today. One of the big economic opportunities, I think, for entrepreneurs that's just around the corner is that most hospitals are viewing themselves today as the nexus of information in their communities. And I'll let you decide for yourself, but by and large, I think they will all, not all, but let's call it half, fail. And they will fail, and when they fail, they will be out of money, highly in debt, and really in need. So the opportunity, whether it's in pharmacy, home health, social work, every different modality to get in with a combination of service and technology that is only triggered, where payment is only triggered by an outcome, is just enormous. And while no one's acting like a buyer right now, I have a feeling that in about 4 years, there's going to be a lot of buyers. 31 seconds. Anybody got a question? Not all at once. Okay, then.